Yeah, so there is a lot of talk about patients going to Turkey mostly for hair transplants. And so my thought on that is there are some places in Turkey, and I've seen some tremendously good results from there. So as long as you do your homework. So let's just not talk about Turkey, but anytime you're going to travel outside of your area, outside of the state, outside of the United States, where you're going someplace else, you have to factor in the fact that you have travel time now. So you're going to leave your home state or the United States, go to a foreign country or to another state. There's travel expenses, there's hotel expenses. You're going to have surgery there, you're going to fly back. What if there's a complication? What's your follow-up going to be? So there's not going to be surgeons in your area that are going to want to take on seeing you post-surgery because they didn't do the surgery and they're not going to take that risk. So you have to factor that. And it's amazing to me how many people don't think about that. The whole surgical process takes about a year for your completion. The surgery is just part of that, and it's a small part because all of the healing afterwards you have to take into consideration. We see in this practice patients calling saying they had surgery done elsewhere, now they have drains, they have sutures that need to be removed, staples that need to be removed, they're having a complication. There's not many people that are going to want to get involved. If you go to another country, not to say that that's bad, but you have long flights, you're going to have to be in a hotel situation. What's that doctor going to be like? Different countries have different qualifications for who can do those surgeries. Here, when you look for board certification, they may not have that in the country you're looking. So it could be anybody doing your surgery. You don't know that. It's hard to do your research for other countries. Not only the surgeon doing it, but what's the facility like? Is it a clean facility? Do they sterilize their instruments? Do they have things that are not outdated that they're just using because even though they're expired, they want to get rid of them? What's your post-op going to be like? What's your management going to be like? So then you got to get back on a plane. And sometimes patients are traveling 14, 15 hours on a plane. After surgery, higher risk of infection. You have a higher risk of clots, DVTs, pulmonary emboli. So you have to take all this into consideration. So it's not that those places are bad, but it can be much more complicated. And chances are you're going to find somebody in your area that's board certified, completely capable. And I understand a lot of patients will tell me it's because of the cost. Well, factor in everything I just told you, and you're going to see that the costs are probably not that much different. Plus, factor in your risk factors. So you got to be really careful leaving the country.